As the human body ages, it experiences a progressive rise in oxidative stress. This occurs because the normal process of living generates reactive oxygen species, or ROS. These highly volatile molecules spend their short lifespans ricocheting against internal structures, causing severe oxidative damage to the cell's lipid membranes. To neutralize this constant threat, our cells rely on a built-in defense mechanism, an intracellular antioxidant tripeptide known as glutathione, or GSH. Clinical observations reveal a paradox. When researchers measure aging cells, they find the underlying machinery required to synthesize glutathione remains physically present and fully functional. Yet older adults still exhibit a profound systemic deficiency in glutathione. This deficiency is not a failure of the cell's internal ability to build the peptide. Rather, the cell's internal assembly line is constrained by a stoichiometric supply chain bottleneck. The machinery is ready to work, but it lacks the necessary raw materials. When you ingest oral glutathione, the complete tripeptide enters the gastrointestinal tract and is rapidly dismantled by digestive and liver enzymes. By the time it reaches the bloodstream, the molecule is destroyed, preventing it from ever crossing the cellular membrane to do its job. You have to feed the cell's internal assembly line with the correct substrates, rather than trying to force a vulnerable external compound through the digestive system. To understand why this combination works, we have to look at how glutathione is built. The tripeptide requires 3 specific amino acids: glutamic acid, cysteine, and glycine. The intracellular synthesis begins when an enzyme seamlessly bonds glutamic acid and cysteine together to form glutamyl cysteine. This step occurs without issue in older adults. The assembly line stalls at the final step. To complete the glutathione molecule, the cell must add glycine, but without sufficient glycine available in the blood plasma, the sequence flashes and halts. The efficacy of this dual precursor approach was tested in randomized controlled clinical trials by Kumar and colleagues at the Baylor College of Medicine. They tracked older adults receiving Glynac against a young control group over a 24-week intervention period. The older adults presented with severe baseline disparities. Their red blood cell glutathione was 76% lower than the young controls, and their T-bars, a critical marker of lipid oxidation, was 845% higher. After 24 weeks of Glynac intervention, the blood data shifted drastically. Red blood cell glutathione in the older cohort increased by 200%. Correspondingly, the markers of systemic damage plummeted. The patients experienced a 75% decline in T-bars oxidative stress markers. The researchers recorded marked metabolic improvements, documenting corrected insulin resistance and a reversal of endothelial dysfunction. Older adults demonstrated increased gait speed, improved grip strength, and higher scores on cognitive tests. The researchers confirmed that supplementing these precise precursors improves the components of 4 aging hallmarks. Repairing the cellular supply chain translates directly to the whole body. Restoring the redox balance restores physical vitality and metabolic health. Does this intervention permanently fix the cellular machinery, or is this restored state dependent on a constant supply of precursors? The 12-week withdrawal phase revealed a critical finding. When supplementation stopped, red blood cell glutathione dropped by 67%, and oxidative markers rebounded toward baseline. Because natural glutathione production declines persistently with age, Glynac functions as a maintenance therapy required for the ongoing preservation of physical and cognitive function. The baseline protocol for Rovitac Glc begins with 1 to 2 doses daily, providing 250 to 500 milligrams of each amino acid. Clinicians should monitor for mild side effects, including gastrointestinal upset, nausea, fatigue, or localized skin rashes. One specific contraindication is for patients undergoing active chemotherapy. An antioxidant surge can inadvertently protect cancer cells from the oxidative damage chemotherapy is intended to inflict. Clinicians should also monitor patients co-administered with blood thinners or severe hypertension medications due to potential pharmacokinetic interactions. The use of Rovitac Glc provides clinicians with an evidence-based tool to support the intracellular environment as patients transition from acute treatment toward baseline health.